Phase 1 AETCOM Module 1.4 is Foundation of Communication. So communication is the fundamental prerequisite in medical profession, and bedside clinical trial is crucial in ensuring professional success for doctors. So this module will provide students with an introduction to doctor-patient communication. Objectives of today's session are: at the end of this module, students should be able to define communication and explain process of communication, explain importance of good communication skills, explain components of communication, describe the types of communication, explain importance of listening, explain importance of empathy, describe techniques of communication, recognize common barriers, and explain 5A behavioral model. So what is communication? The word communication has originated from Latin word communes, which means something common. We can exchange information, ideas, thoughts, feelings, and emotions through the speech, signals, writings, and behavior. And we can define communication as the process by which information is exchanged between individuals through a common system of symbols and signs of behavior. Robert Anderson defines communication as uh, the interchanging of thoughts or opinion or information by speech, writing, or signs. Then the goals of the communication are: cognitive goal is to gain knowledge, to get and give information. Affective goal is to change the behavior and attitude and to ensure understanding. Psychomotor goal is to perform new skills and to get into action. Which factors are involved in communication process? The factors are sender, encoding, message, channel, receiving, and decoding. So communication is a continuous process that mainly includes three elements: sender, message, and receiver. So the elements involved in the communication process are explained in this diagram. So first is sender. Sender or communicator generates message and conveys it to the receiver. So sender is the source and the one who starts communication process. Second is message. It is the idea, information, view, thought, opinion, feeling that is generated by a sender, and it is intended to be communicated further. Then the third um factor is encoding. So the message generated by the sender is encoded symbolically, such as in the form of words, pictures, gestures, before it is being conveyed. Fourth is media. So it is the manner in which the encoded message is transmitted. The message may be transmitted orally or in writing. The medium of communication includes telephone, internet, uh, post, fax, email. So the choice of medium is decided by the sender. Fifth factor is decoding. It is the process of converting symbols encoded by a sender after decoding the message is received by the receiver. Then the sixth factor is receiver. Receiver is a person who is last in the chain and for whom the message was sent by the sender. So once the receiver receives the message and understands it properly, uh, when he understands it in proper perspective and acts accordingly to the message, only then the purpose of communication is completed or it is successful. Then seventh factor is feedback. Once the receiver confirms to the sender that he has received the message and understood it, the process of communication is complete. And eighth factor is noise. So if there is any obstruction that is caused by sender, message, or receiver during the process of communication. It is known as voice. For example, bad telephone connection, faulty encoding, faulty decoding, inattentive receiver, poor understanding of message due to prejudice or inappropriate gestures. These all will lead to noise, and the process of communication does not succeed in that case. Now we will see the importance of communication skills. To seek healthy information and work effectively with healthcare team, a doctor should communicate skillfully and build rapport with their patients. By active listening and showing empathy and having other such communication skills and with sensitive behavior with the patients, chances of medical errors will reduce. Valuing patients' beliefs, perceptions, expectations, responding them when they are in emotional distress, treating them with patience. These all things will make patient comfortable. It will decrease the patient's anxiety and will increase patient's satisfaction. When a doctor is very clear and honest in his communication, then there is way for accurate diagnosis and treatment decisions, because the patient will also become comfortable to share information with the doctor. Confidential communication between members of care team results in swiftly and ethically delivered care without breaching confidentiality. So, when the physician is effectively communicating with the patient, the intimate information shared by the patient and other relatives should be ethically delivered, and the confidentiality or the privacy of a patient should not be breached. Building trust through effective communication can encourage patients to remain adherent to the treatment. Of course, when the patient gains trust to the doctor, compliance of a treatment will increase. Providers can help patients feel heard, ease their fears, and encourage them to disclose relevant information. The patients will feel more safe when they are getting the treatment. Ultimately, doctors competent in communication skills will provide high quality patient outcome. There are three components of communication skills: verbal communication, non-verbal communication, and paraverbal component is there. First component of communication skill is verbal communication. Verbal communication includes what we say or write, or how we say that, how we say something, whether the tone or volume matches the message. So, the factors that contribute to the verbal communication are content or the word choice, the vocabulary that we use while communicating, whether it has positive or negative connotation. Then the second important factor is speed of speaking. So the delivery of speech or use of pauses. Third important factor is volume, pitch, and tone. Voice, whether it is high pitch or low pitch, it should be appropriate for the situation. Then comes the clarity, words enunciated properly with clear information. And last component is active listening, that is concentrating or showing interest. That all comes under verbal communication. So we use verbal communication to frame our message more effectively. The verbal communication includes intonation. Intonation defines how the pitch of your voice increases or falls during a speech. A shift or variation in pitch can have an impact on the meaning of what we say. Second is stress. So, stressing is the process of emphasizing a word or a statement in order to bring attention to it. Then comes pauses. The pause allows speaker to gather uh, thoughts before making final argument. So this allows the audience to uh, say up with you while also giving them a time to process what you just want to start. Then is the focus stress. Listeners' attention is drawn to a certain word or phrase when there is focus tension. So the employment of focus stress is used to clarify, emphasize, or demonstrate anything. Then comes pace. Pace is the rate at which you speak. The pace might be rapid, slow, or moderate, and it can fluctuate throughout. It is claimed to vary the tempo, quickening up at times, and then slowing down, depending on the scenario and significance of the context in order to keep audience attention. Second component of communication skill is non-vocal communication. It is the technique of transmitting meanings without use of written or spoken words. So, non-verbal communication refers to any communication that involves use of facial expressions, hand motions, body language, posture, use of gestures. So these non-vocal clues can provide insight, supplementary information, and significance in addition to the spoken communication. So the non-verbal communication includes facial expressions. So happiness, sadness, anger, fear, these all come under non-verbal communication. Second is gestures. So waving, pointing, using fingers. Third is paralinguistics. Tone of voice, loudness, then inflections and pitch. Next is body language and posture. So defensive posture, arms crossed, legs crossed. So these are all body languages. Then comes proxemics. So the amount of space we perceive as belonging to us is influenced by number of factors like social norms, cultural expectations, or the situational factor, personality characteristics, and level of familiarity with that person. So these all come under proxemics. Then eye gaze, looking, staring, blinking, steady eyes. So these are all related to trustworthiness, inability to maintain eye contact, may sometimes indicate lying or being deceptive. Then haptics and touch. So these show affection or familiarity and sympathy. Then comes the appearance, choice of color, clothing, hairstyles, and lastly artifacts, surrounding themselves with objects designed to convey information about them, like uniform. For example, doctors wear white lab coats or aprons. Component of communication skills is paraverbal component. Again, the tone, pitch, pacing, and volume comes under paraverbal component. So a sentence can convey entirely different meaning depending on the emphasis of words and tone of voice. For example, when someone is angry, their voice tends to be louder. So when the verbal component is matched with non-verbal and paraverbal communication, it increases clarity, trust, and builds rapport with the patients. Types of communication are organizational structure. In it, we have formal and informal communication. Formal communication is flow of information through formally established channel in an organization. So these type of communication can be oral or written. Informal communication refers to communication on the basis of personal relationship. It is a type of communication which is unstructured, unofficial, and unplanned. Next is according to the direction. We classify communication as downward, upward, horizontal, and diagonal. So, when the communication takes place from superiors to subordinates in a chain of command, it is known as downward communication. When messages are transmitted from bottom to top of the organizational hierarchy, it is called upward communication. When the communication takes place between two or more persons who are working at same level, it is known as horizontal communication. And diagonal communication is exchange of information between person at different level across different departmental lines. Then the communication through mode of expression. Again, when the communication occurs through expressions, gestures, or postures, it is known as non-verbal communication. It refers to the flow of information through facial expression or tone of voice and other body movements. Verbal communication is exchange of information by words, either written or oral. So, verbal communication consists of speaking, listening, writing, reading. So, it is most preferred mode of communication. And its subtypes are oral and written communication. Oral means when a message is expressed through spoken words. It may be either through face to face conversation or with the help of electronic modes such as telephones, cellular phones. And written communication when the opinion are exchanged in written form rather than by spoken words. It is known as written communication. 7 essential elements of communication are: build the relationship. This is fundamental task. Then open the discussion, establish focus and agendas. Gather information through active listening. Understand the patient's perspectives by being empathetic. Share information which is tailored to the patient. Reach agreement on problems and plans. And lastly, provide closure, that is follow up and safety. There are 7 essential elements of communication. First is to build relationship with the patients. So while interacting with the patient, the physician should gain patient's confidence and trust. A physician should have patient-centered approach. Respect your patients regardless of their age, gender, culture, beliefs, and other factors, and make the patient comfortable during history and physical examination. Open the discussion. So let the patient complete their opening statement through positive body language and show that you have interest in the patients and develop personal rapport with them. Third element is gather information. So use open-ended and close-ended question. Information gathered from the story of illness narrated by the patient helps to diagnose illness, and through this information a doctor can derive to diagnostic and therapeutic plans for the patient's benefit. Open-ended questions help to answer, give reflection, and it encourages the patients to disclose information and explain their emotional and behavioral state also. Whereas closed-ended questions restrict the response and inhibits thoughts. Then the next important factor in gathering information is active listening. So in the next slide, we will see in detail what is active listening. So, listening is the ability to accurately receive and interpret message in the communication process. So, listening is key to all effective communication. Without ability to listen effectively, messages are often misunderstood. As a result, communication breaks down and the sender of the message can easily get irritated or frustrated. So we can define listening as a process of receiving, constructing meanings from and responding to spoken or non-verbal messages. It is important to listen because we have to show that we are serious, we display respect to others view, we and this will help us to learn and help us to adapt and understand and to empathize. There are five types of listening: informational, critical or active, selective, empathetic, and ignoring listening. So, informational listening is to gather new information and facts from the patients and not criticizing or analyzing. Second is critical or active listening. So, understanding, interacting, and giving feedback, evaluating, and analyzing the information is critical listening. Third is selective listening. Remember only selective portion or points. Topic is not to our liking. In that case, there is selective listening. Then fourth is empathetic listening. So there is excellent discrimination and close attention to the nuances of emotional signals. When we are being truly empathetic, we actually feel what they are feeling. And last is ignoring listening. So not listening at all or insulting, that leads to strained relations. Signs of active listening are positive reinforcement and facilitation. So, facilitation is a technique of verbal or non-verbal communication that encourages a patient to continue speaking. So, if the doctor says good, yes, or so these are all signs of doctors showing that they are attentive. Okay. The next point is remember. So, the doctor should remember key points of previous conversations. Questioning or asking relevant questions to the patient shows doctor is interested and is ready to help the patient to clarify their thoughts. Next is reflection. Reflection is repeating patient's information in order to show that you are understanding their emotional as well as medical needs. Next is clarification. So by asking questions, you can ensure that correct message has been received. Then summarization involves shortly concluding patient's information and emphasizing on the key points. The doctor has stress and workload, so there is time constraint. But the doctor has to explain the patient about time constraint properly. Principles of active learning are listen actively, be silent. So we listen to obtain information, we listen to understand and to learn. Second is show interest. So don't get distracted by your surroundings or by counter arguments while the patient is speaking. So show interest when the patient is speaking. Then be empathetic. Respond to convey understanding of patient's perspective. Next is ask questions. So clear patient's issues and concerns. By asking patient, you can involve them in decision making and provide feedback to them. Next is maintain eye contact, but don't stare. Maintaining eye contact will make them comfortable and make them realize that you are attentive and encourage them to continue speaking. Then take notes. And seventh is keep patience. Let the patient continue to speak in their own time. Never interrupt or finish sentences. Then be impartial and do not judge the patient. Avoid or eliminate distractions. And lastly, try to gather information about the topic to develop interest and familiarity. Means move out of the box. It's not just medical recording, but you have to show that you are socially or emotionally attached to them and fulfill their emotional as well as medical needs by gathering information about the topics that develop interest in them. Common barriers in effective listening are prejudgment about the speaker, assuming that the speaker is going to give some unimportant information. Active listening is important because it provides better environment for sharing information. It improves doctor-patient relationship. It improves perception of confidence and respect in patients. It lessens the stress and reduces uneasiness in the patients. It improves patients' safety and satisfaction. Ultimately, it leads to improved health outcome. What is empathy? So, when a patient gives history of his clinical condition, it is not just the signs and symptoms. He is actually narrating a story of how illness has affected his family, how it has worstly affected his social life, how it has led to distress in his career. So, there is a sense of grief, regret, and many such difficult emotions are involved. Maintaining empathy is again very difficult on the part of physician, because on one hand we as physician know the actual clinical condition of the patient and we need to explain the real health status to the patient, that is without detached cognition. On the other hand, we say that the physician can accurately view patient's emotion. So, empathy involves more of emotional resonance. And we can define empathy as the act of correctly acknowledging the emotional state of another without experiencing that state oneself. So, this word empathy is derived from a Greek word empathia. Empathia means in and pathos means feeling. So, inner feeling. Clinical empathy is to understand patient's situation, perspective, and feelings and to act on that understanding with the patient in helpful way. So, there are four components of empathy: emotive, moral, cognitive, and behavioral. Emotive empathy is the ability to subjectively experience and share in another's intrinsic feeling. So it is again dealing with emotional aspect. So some uh, physicians are more concerned about danger of getting too much involved with the patient's emotion, while for some physicians it is just a professional interaction. Then the second aspect is, or second component is, moral empathy. So it is internal altruistic force that motivates practice of empathy. So the moral stance is more of ethical values. Third component is cognitive empathy. So it is intellectual ability to understand another person's perspective from objective stance. So it entails physicians intellectual entering into patient's perspective, beliefs and experience without feeling patient suffering at emotional level. Okay. Then the fourth component is behavioral. So here the communicative response to convey understanding of another's perspective is behavioral empathy. So it is more of action component. So the physician is able to act accurately on the basis of understanding, and it is done by checking back with the patient that you have understood correctly. So by taking feedback from the patient, that is behavioral or communicative response. So these are the four components of empathy. Why do we need empathy in our practice? Empathy is important because it builds patient's trust, it decreases anxiety of the patient, it improves health outcome, it increases the adherence of medication by the patient, it decreases malpractice and medical errors, and it increases patient's satisfaction, and expressing empathy advances humanism in health. Fifth essential element of communication is share information. So the doctor should discuss nature, course, prognosis of disease, necessity of investigation and treatments available in a simple language which can be understood by a patient. Again, details of expensive investigations, drugs, and their effect on the course and outcome of the disease should also be discussed by the doctor. Sixth essential element of communication is rich agreement on problem and plans. So, formulate and discuss future plans of treatment with the patients by involving them in decision making. So, during planning, always consider patients' understandings, values, beliefs, culture, and willingness, and also consider their socio-economic status. Keep on motivating your patients in order to improve adherence or compliance to the treatment plan provided by you. The seventh essential element of communication is provide closure. Again, this is important part of medical interview. Ask the patient about whether he has any concern or any issues. Then the doctor should begin to summarize some important issues that are discussed along with the treatment and future plan. Always have a second plan of action for unexpected health outcomes. Barriers faced during doctor patient encounter are related to the physician are lack of communication skill. So as the physician does not undergo any training program for communication skills, he may lack in that skill. Then second is use of jargons or language barriers. So the physician should use simple language which is understood by the patient. But if he uses some medical terminologies, again that will make it difficult to understand on the part of patient. Third is lack of respect or interest. So lack of respect mostly if there is a feeling of superiority, and lack of interest means when there is no active listening by the physician. Mostly it is due to time strain, or it can be due to the workload. Fourth is very important factor, or the most important barrier, that is workload, stress, and lack of time. So the physician has to do multitasking. So due to increased workload or continuous stress, and it is difficult to manage time, there is lack of time, again it causes barrier in communication. Physical and proximity barrier, as we discussed earlier, if there is no eye to eye contact or social touch. Then next is fear of litigation and abuse. Nowadays, there is increase in conflicts in doctor-patient relationship. So the doctor is preoccupied with the fear of litigation or some kind of abuse. So again, that creates a barrier. And lastly, inadequately informed patient. Either the physician does not feel it important to explain each and everything to the patient due to lack of time, or there can be lack of active listening. So because of this, the information is inadequately shared with the patient. Now on the part of patient, the barriers are: first is emotional barrier. So some patients find it difficult to express their emotions. They are not comfortable in talking about some difficult topics. Then second is attitudinal barrier, or uh, barrier in behavior. So there is perception that may result from personality conflicts or poor management, or lack of motivation. Next is expectation and beliefs. So These beliefs may lead to false assumptions or stereotypes. And then cultural barrier, there are certain social norms of interaction, and they are variable depending on the culture, such as concept of personal space varies between uh, cultures and between different social settings. And lastly, the system barriers are lack of sufficient time for consultation, lack of privacy during consultation, noisy surrounding, lack of support from other workers, healthcare team workers like nurses, pharmacists, technician, or rehab specialist. Then lack of continuity of care with the patient. These are all common barriers during doctor patient encounter. There are certain critical situations where communicating with a patient becomes very difficult for a doctor. Such situations are breaking bad news, communicating people with mental illness or who are victim of abuse, dealing with violent patients, communicating patients with severe disabilities, or helping vulnerable patients. There are 7 steps of effective communication when there is doctor patient encounter. So, first step is doctor should greet the patient with a smile and inquire by their names and introduce themselves. A doctor should assess their body language while speaking. They should have social touch with the patient. They should make eye contact and be face to face while speaking. Doctor should show respect and strive to maintain dignity of the patient. Give your patient ample of time to respond, to think, to ask questions. Have patience. Now the patients that are coming to you are of different age group. They may be old, they have illness, they may have cognitive difficulties. So give them time to move at their pace and show patience to them. Then speak clearly and slowly in a simple language which the patient can understand. Do not use jargons and be active listener. Then you should take notes, maintain records, and the documentation should be accurate. Also provide written instructions, use graphics and follow list wherever it is necessary. This will increase the compliance or adherence of the patient to their treatment plan. And lastly, adopt shared decision making practice with the patients. Involve your patients also in making decisions for them, and share your notes with the patients wherever necessary, and clarify follow up visits and acknowledge the patients. Slide provides complete information about 5-way behavioral change model. So the 5 A's in this model are assess, advise, agree, assist, and arrange. And the goal of this model was that all the chronic illness patients will have a self management action plan. And this model is intended for use with the improving chronic illness care, chronic care model.